Oh, fantastic. And you're talking about one of the most proficient functional medicine doctors in the US. And when I read your book, the pastor Rick Warren, there was an example, and I want to just share that with the audience and share that with the Facebook Live, as well as my podcast listeners, is that with Rick Warren, with Mark Hyman, with Dr. Daniel Amen, they were able to institute this process of weight loss. As Rick Warren was battling with his health and his weight, he instituted across 15,000 church members. Can you just expand on what actually happened in that example?
Yeah, so Rick Warren is a pastor of like a mega church in Southern California, and they have 15,000 people in the church. And, he brought in Mark Hyman and Daniel Amen to help him because he was morbidly obese, and so was most of his community. And what they realized, they sort of did a little background research and realized that, yes, there was a Sunday service where they'd all sit there, but that they had these small groups of Bible study on a Wednesday. Okay. And so they came up with this idea called the Daniel Plan, and it was really helping those groups of 5 people to provide these sort of like accountability structures for people to start to execute healthy behaviors. And it was such a wild success. I think 15,000 people lost 250,000 pounds, which is about 17 pounds per person, which is about 8 or 9 kilos per person. So, it was a huge success, and really showcased the power of using small groups and communities to transform health outcomes. And it's a big deal because, that in functional medicine, which has been my world for the last 15 years, one of the biggest problems with it is that it's not really delivered in a way that could benefit most people. I mean, in South Africa, I know the functional medicine ecosystem a bit there because it's a few years behind, the US and the UK. You really have expensive, it's relatively unaffordable. And so it just means only certain people can access it. And when I first heard about this group delivered care model, and when I started to look at it, I realized, okay, this not only could be a solution for the affordability piece, but actually could solve the biggest problem with functional medicine, which is that it's built on behavior change. And behavior change in one-on-one with practitioner to patient, that has not been a success as far as I can see. There are some successes, but in general, a doctor can't really inspire patients to facilitate behavior change consistently. You need a different structure, and groups is a great way to do that.
So if groups is a great structure, tell me, has this taken much traction in the US and the UK, and why have not many people heard about it? When I speak to, the medical fraternity, they don't know much about, the group visit. They don't know much the structure of how to institute it in their practices. They're concerned about multiple factors like revenue. They don't have the skills or be equipped to run these groups. Why hasn't it not gained much traction that people would have heard about it?
Well, it just depends what kind of groups you're talking about. I mean, I think everyone knows, like, Alcoholics Anonymous has grown around the world, and people know that if you have someone who has alcoholism, that they don't need drugs, so they don't need doctors. They need accountability and support and peer-to-peer support of people who have actually been there. And ultimately, why I called my original book and my business The Evolution of Medicine is because medicine is having to work to adapt to this new environment, right? In South Africa, the gap between TB being the biggest killer to type 2 diabetes, that took like 10 years, right? That same gap took 100 years or 50 years in America. And so, you see that the kind of medicine, the kind of issues that we have has changed, and medicine hasn't changed. We still do type 2 diabetes with a sort of as though it's an infection. So we have a lot of drugs, we have a lot of doctors, we have a lot of management. And ultimately what we need is a little bit more of a group support. So it is new, and it hasn't arrived mainly like I wrote that book so that we would be able to like showcase the success of these groups, so that my goal with that book was that if someone who was, let's say, the manager of a hospital in South Africa would read the book and go, this makes a lot of sense. We should be doing this. And that was the purpose was really just to accelerate that movement. So I would expect that it'll start to grow for a few reasons. One is it's solving a need that is like massive and growing. Two, it is both affordable for the user and profitable for the institution running it, which is kind of like a very interesting sort of combination. Because like you said, like, you know, functional medicine, one of the reasons why it hasn't grown inside the payer system in America is that no one's really found a way to do it that's been profitable for profit-seeking hospitals. And so, you know, if the government's doing it, it's much more affordable and efficient. It's super efficient. I mean, one practitioner to 20 people as opposed to one-on-one, you know, the scale is huge. And then also, you know, another big factor that we've seen in South Africa, like I came 4 years ago and gave some public talks there about functional medicine. Okay. It takes a long time for a doctor to really get trained in functional medicine. But, you know, we see in the Cleveland Clinic example that health coaches, PAs, and dietitians who have never, you know, run anything functional medicine related were now able to run these groups, you know, within 6 weeks because there was a curriculum and it was really just about being with people. And so the potential for it to scale up is there. So all the pieces are right. The one thing that threw a big spanner in the works is COVID, because getting people in a room together, you know, suddenly was not possible. But I expect that, you know, I think that certainly COVID has shaken the sort of inertia that existed in transformation, and possibly we could be in a position where we would see large-scale adoption of these ideas in the next decade.
Fantastic. Just walk me through an example if a patient would try and institute a group visit or do this group work, this community, they're a type 2 diabetic or they got insulin resistance. What do? Do they speak to their functional medicine doctor and say, well, I've got 2-3 of my friends, can you run a group? Or, you know, is the doctor the main person running the group, or is there an occupational therapist or a health coach or a health advocate? Just walk me through the process of how this can be instituted practically from tomorrow. If someone who's listening who's got either type 2 diabetes or has got rheumatoid arthritis, what should they be doing and how should they be going forward?
Well, look, executing this from the patient position is not that obvious. I mean, it's a lot more obvious for a medical practice or a hospital or a system to start to implement it because they've got 100 type 2 diabetics patients, and rather than seeing them one-on-one every month, why not put them into 5 groups of 20 and have more extended visits with them? So, you know, on that. But if you're a regular person, like I'm in a weekly men's group, right, that I'm with a group of men. And, you know, it's a group that doesn't cost anything. And even though it's not a health-related group, I am, you know, I know that the other men in the group and either myself are healthier as a result of it because there are structures for accountability. So one of the guys in the group right now is doing 100 push-ups a day, and he comes back every week to share how that's going for him. And he knows that he's going to have to report in on it. And so he does it. And it doesn't, you know, so, you know, ultimately there's a range of how medical these groups have to be. Okay. Right. So the kind of groups that I'm talking about in my book are very much on the more medical end, where there's health professionals there all the time, and they're like helping to institute the conversation. But I would say, you know, on the patient side, you know, what if you were to use something like Eventbrite or meetup.com or Facebook to find other people that had a similar condition than you, you know, find some content that, you know, like if you look at, there's a functional medicine book on every topic. So let's just say rheumatoid arthritis, right, that you wrote. Susan Bloom has written 2 books on arthritis through a functional medicine lens. Basically, you could start a book club where you met every week for like, you know, every week and just go through a different chapter of the book. What did you learn? Let's hold each other accountable to executing some of these ideas. Could be as few as 3 people. Could be as many as 20. And it doesn't have to cost anything.
So is the power of the community, the accountability that one has to the other, and is that where the power and the force is that Dr. Hyman spoke about? Is that what it's really about?
Yeah, I think it's accountability is a huge piece, because I think we all have a list of things that we know that we should be doing that we're not doing. However healthy we are, you know, we all know that there are some behaviors that we do that aren't unhealthy, but we're either like physically addicted to them or just socially conditioned to continue to do them. And if you want to get out of it, having that support and accountability. I also just think being able to, like, you know, look, we live in a super traumatic time. right? This, wherever you are in the world, it does not feel safe, right? Whether there's a COVID attacking us, or whether there's riots, or whether there's you can't get a drink in South Africa for 2 months, whatever your feeling is, I don't think there's a lot of people feeling safe right now. And so even just having a structure to be able to share what's going on, my men's group has moved on Zoom. In fact, last week we had our first in-person meeting again. It was a socially distant circle, but we've been meeting over Zoom for the last 2.5 months. And I know how valuable that's been to me, to be able to, connect with the same men who I built trust with over a period of months, and to be able to share what's going on in our world. And if there's something really strong, that everyone's there to listen and connect and to give support. And so it's not just accountability, there's an opportunity for vulnerability. And the truth is, we all have a lot of value to offer each other. And, value added to each other is something that's kind of been taken away as community has been destroyed. And we rely on the government or market services to solve problems that used to be part of community, grief counseling or elder care or babysitting. And as we're all kind of put into our own little box, which we're hyper aware of since being in COVID, we rely on each other for a lot of things. And ultimately I see that, even if you look at nature, the way that nature deals with a lack of resources is community, because you need those positive feedback loops from a group of people to survive. And so I think it's just a natural, it's just part of how nature does things, and we should look to nature for how best to survive in these situations.
Absolutely. Looking at nature, ancestral wisdom in terms of, South Africa, they speak about Ubuntu, the community coming together. Nelson Mandela said of his father that they always used to sit in a circle, and his father was the last one to speak. And you mentioned listening, and you referred me to a book called Time to Think by Nancy Klein. Skills on listening and hearing one another, skills to value and delight in other people's purposes and value that they bring to the group, that is so important. But maybe we're a little bit far behind here in Africa. It just seems everybody's becoming an island to themselves. They're not sharing their hearts. People are putting masks on. They're not really sharing themselves. And there's not really much safety at work. It seems like people have become more islands. Is there a breakthrough that we're sort of less aware of, that people are going to gather together again and help each other, truly support one another and surround one another in these times? Because it seems like it's going the opposite way with technology and life and just not sharing who you really are.
Well, look, honestly, that's why I'm in medicine and in healthcare, because I feel like that's actually the opening, because we're not going to be able to do things the way we've been doing them in healthcare. You can avoid, in almost every area of your life, you can avoid vulnerability with other people. But ultimately, I feel like there's a moment that happens when you get diagnosed with a chronic illness, and everyone sort of comes across this at one point in their life, unless they're doing things very healthy, where they're faced with a choice. Do you want to keep doing things the way that you have, and this is going to get progressively worse and you're going to die with it? Or do you want to take action from a news story about yourself, a new story about what's possible, a new story about how you interact with the earth and the people around you? Okay. And that's where I think there's a lot of power. And so ultimately, and also there's a lot of urgency, because then people now suddenly are, really engaged. So for me, I think that why I've chosen to bring this message in healthcare is because eventually everyone's going to have to listen at one point or another. And that's why I think, it's the right place to start this movement back in the other direction.
Great. Just tell me about being a mentee to someone and a mentor to someone. Have you got a mentor? Are you mentored by someone? That's a type of community. If you had to define community, what would you say it is? A group of people. Who is your mentor and who do you mentor?
Yeah, so, my favorite definition of community is from Charles Eisenstein, and he says it's a group of people bound together by gifts and stories, right? So the story has to be the same, right? You have to be in alignment about how you see the world. But community is all about gifts, and it's giving gifts and receiving gifts, and mentorship is one of those gifts. And so, I've had the pleasure and gift of, over the last 15 years, and before that, having a number of different mentors in all different spheres that have helped me, realize my own potential. And, there were many lessons that I learned in running medical practices and so forth that I created a whole business around in helping other practitioners kind of form a community where they could go and build these kind of practices in the future. So yeah, I feel very blessed. In the last 2 years, Jeff Bland has been a really strong, a direct mentor for me, and he's really helped me see how I could have, facilitate a lot more potential in myself by playing to my own strengths.
Okay.
But sometimes it's just not like some of the advice that he gave me about what I should move forward in my career, like I didn't even know those things were possible.
Okay.
And so just being able to sit with someone who's 40 years older than me or 30 years older than me, and to be able to get that wisdom. So yeah, I think it's a huge part, and that's a huge part of what community used to be. Elders mentoring younger people, and part of that's what's been lost in our hyper individualized society.
Great. Just finishing the Facebook Live. Just tell me about health coaches, their role, or health advocates, and how you see them being instrumental in this community cure.
Yeah, look, so we've been on a tip for health coaches since we started the Functional Forum. We realized that, most health professionals and doctors are not necessarily trained in behavior change. We need behavior change. Coaches are trained in behavior change, and it's like the biggest part of what they do. And so, I think they play a critical role. One of the things that I've seen through this book is that there's a real missing critical component in healthcare. And the reason why doctors have not been good at facilitating behavior change is because if you have a chronic illness and your doctor says, do this, do this, do that, the feeling that you come away with is that this doctor doesn't know what it's like to be me. This doctor doesn't have an understanding of what it's like to live in my shoes with this condition. And a lot of people lie to their doctor, right? How many drinks did you have this week, right? What percentage of the answers to that question are truthful? And so what we need is, is a place where people can really get into that kind of stuff. And most people who become health coaches do it because they have their own issue, they overcome it, and they want to help other people. And maybe they're, that far into their career that they can't afford to go back to medical school for 11 years, or even that they realize that medical school is not going to train you to get the help that you need. And so, all of my efforts with Fine Functional and with functional medicine has all been to try and, put the coach as the most important position, and, use the doctor only when needed, rather than focusing on the doctor, then bringing in the coach when needed, because ultimately it's about behavior change. Okay. And so it's a big piece.
Sure. Well summarized. There's a lot of value there. To my Facebook audience, this Community Cure, incredible book. I've learned so much in terms of groups and group visits. And I'm going to connect with some of James' contacts in South Africa, who he's put me into contact with, so we can really institute and get group visits going, speak to, any endocrinologists I know, or people that do, doctors that do functional medicine, and see if they can institute some groups and see the long-term outcomes of it. So where can people find you, James, with regards to your social media or your website, and where can they get a health advocate or a health coach through your network?
Yeah, so findfunctional.com is a service that we launched just at the beginning of COVID to, to connect people with a digital advocate. It's they're all trained in health coaching, they're all trained in functional medicine, but they also have all either reversed a chronic illness in themselves or someone in their close family. And then behind that, we have the network of doctors that we've been building for the last 6 years. So that's it's a new service. If you want to read the book, you can go to thecommunitycure.com, or you can find it wherever books are sold. And it's also on Audible if you like the smooth sounds of James Maskell.
Sounds good. Well, thanks so much for your time. And we're going to carry on with the Made to Thrive show, the podcast. We're going to be putting some links on Facebook just so that you can finish the podcast listening to it if you want to. And thanks so much just for your time and who you are. And yeah, as I always say to my community as SteveStavs and Made to Thrive, one of our pillars is the community pillar. Purpose and community are the two most important pillars in Made to Thrive. You need to always be and stay surrounded. Thanks so much. And we'll do another live show soon. So let me know your queries and comments and we'll get back to you. Thanks so much, James. Appreciate that.
Great.
I just want to carry on and I just want to talk about just a little bit about the Harvard study that was done. You know, I think it's one of the longest Harvard studies in terms of how community brought such joy and happiness to people over, I don't know how many years. They did thousands and thousands of samples. Do you know much about how community involved in terms of just joy and happiness and sense of well-being?
Tell me.
Well, you know, I think one of the most important factors for, you know, just sense of well-being and happiness and joy was the Harvard study that was done. I think it was Weinstein that did it, that showed that the happiest people that had the most longevity had community. They had good social relationships and social structures in place, and that far outweighed monetary value or materialism at all. And it sort of correlated with the blue zones as well. So I know you wrote a little bit about blue zones and the evolution of medicine. How important are those social structures in terms of, you know, feelings of well-being and happiness?
I mean, look, it's a big deal. You can see it. I mean, I think there's different ways to find it, right? You can look at a study from Harvard and see it. You can feel it in your own personal experience.
Yeah.
Or you could just look at the healthiest places in the world where people live to 100 consistently without chronic disease in the blue zones. And it's a big piece of that too. So, you know, it doesn't take a lot to work out what it is. This is how we evolved. And ultimately, you know, there's a lot to learn from cultures that had community or that were built around community, which was all of them, because ultimately, you know, you need nature shows us that you need the positive feedback loops of being in a community in order to survive. And so, you know, it's really powerful and we're wired for it. And when we don't get it, things go haywire. You know, one example I used in my book, which I think is really interesting, is just the preterm births and pregnancy, because ultimately, you know, pregnancy is not a disease, but you know, in parts of America, there are 30, you know, that there are that many preterm births. It's like similar to sub-Saharan Africa, and that's because, you know, there's trauma, there's cultural trauma, there's cultural issues. And ultimately, the way to solve those issues are to put people in circle and connect. And, you know, ultimately, that's a great example of what can move the needle.
It just seems like, I don't know, is it the industrial age that brought on sort of individualism, or is it capitalism that's brought on this individual nature where we just, you know, we squash on people, we climb this corporate ladder. It's not about us, it's about me. You know, I look at Cyprus, where my parents are from. It was very about the village mentality. People gathered around the square. It was really about connections. But it almost seems like this capitalistic drive and individualism to succeed and achieve has sort of broken that how important those community structures were.
Yeah, I mean, it's multifaceted for sure. I mean, one great example I didn't put in my book, but it was in my TED talk from 2015 was the area of Pennsylvania where a lot of Italian immigrants moved. Yes. And, you know, they ended up, you know, having a community there, and they had much lower levels of heart disease, you know, even though they smoke and drank and did all the things that Italian people do. And ultimately, when the society westernized, the levels went back up to normal. So there's something really, you know, really protective about community, really heart protective, really health protective about community. And so, you know, ultimately, you know, a big part of it is capitalism. And it's like getting one over on each other, but it's also like, look, if you're selling lawnmowers, you want everyone to have a lawnmower because you've all got a lawn. but ultimately it doesn't really make sense. Like, you probably need one lawnmower per street. You don't need to own your own lawnmower. You could have one lawnmower that's used by 20 people. You're not mowing your lawn all the time. And so, just that mentality of like, okay, I've got my house and I've got one of everything that I need and I don't need to share. Like, that's another part of capitalism, because you're growing the market significantly. And so, ultimately, one of the things that we started to see over the last 10 years has been the sharing economy, right? So, you don't need to own a car. Like, I lived in Venice, California, and most of my friends, which is part of Los Angeles, most of my friends didn't have a car. They used Uber if they needed, but then they would also use things like Turo, which is this like car sharing site where I borrow someone else's car that's just sitting there. And so structures have evolved to sort of, to replace and actually to commercialize what would have just been community before. But I think more and more people are looking for community experience, and ultimately it's way more efficient, it's way more cost effective. And so you're starting to see those kind of models reemerge.
Great. I think you're talking about the Rosettans that came in from a place called Rosetta in Italy, and Malcolm Gladwell wrote about that in, I think, his book Outliers, in terms of,
that's right,
had terrible diets, no increased exercise in the town next door, but had good social structures, had pediatricians who had as much value as the greengrocer. There was no hierarchical structure in terms of just because you educated more than the person down the road. There was a very flat structure in place. What I'm interested also in terms of just community is, Kelly Brogan has done this advanced praise, which I read out to the Facebook audience today, but I think it's incredibly well written. How has it worked within psychiatric patients, or patients with depression, or patients with, any anxiety? Have you found that the community group visits have worked exceptionally well in that area of medicine? Yeah,
it's doubly powerful, I think, because mental health is sort of one of the biggest. It's a symptom of the cause that is, all these issues. We're really seeing whole body psychiatry now, where people realize like mental health issues are not just it's not dysfunction in the brain. It's the fact that the brain is just, communicating messages from the rest of the body. And if you have whole body inflammation, you end up having anxiety and depression. And that's just like your mental health symptoms are a function of, what's going on in your body. So one thing that, Kelly is a great example, I think, for the functional medicine community, because when I first met her 7 years ago and she was practicing in New York, she was doing kind of functional medicine, how it's been done for the last 20 years, which is long appointments, digging into people's medical history, complex protocols, and all of those, that's like the way that it's been. And then she when she wrote her first book, she just, created this course, which was like her protocol, kind of in an easy way to do it, which is a lot of like Kundalini kind of breathing, and then like a nutritional protocol, stress management. And then she created this group. And what she saw in the first days that she started this group of people who came in was that people who were trying to taper off medication, which was her client base, or if you wanted to taper yourself off a benzodiazepine, you probably never met in your life anyone else who's trying to come off a benzodiazepine.
Correct.
And so rather than be the only person in your community that you've ever met, now you had another group of people who were able to like really validate each other's experience, right? And not just validate it, but actually support them, because this woman is like 80% titrated off her benzo. This woman is completely off, and this woman's just getting started. The value transfer from the person who's almost finished to the person who's just getting started is massive. And just creating a structure where that value could transform, she basically realized like, this is an incredibly powerful force that has never been activated, because medicine's been all about privacy, right? Privacy has been our number one focus. Honestly, it's part of the reason it's a continuation of capitalism in medicine. Because ultimately, like, if people can't talk about their experience to anyone else, they're going to have to go and pay for the medical professional to do that. And so, so ultimately what Kelly saw was that the community actually was the most important piece, and her protocol was totally secondary. So when she did another iteration, not just like a course plus a Facebook group, but actually where the group was the focus and the content, the like, you know, what they did was secondary, it was even better. And ultimately, you know, going through sustainable changes in a slow and methodical way was just what needed to happen. And people got better really quickly. And so, yeah, I put it in the book. And I think that psychiatry is in desperate need of it. I think, but really, you know, all of these chronic conditions that are as a result of, you know, look at South Africa. I mean, when I lived in South Africa when I was younger, there's no McDonald's, right? And now here we are, 30 years later, and McDonald's is the cool place to go and eat. I don't know if it's still like that. I haven't been for a bit, but so sad, you know. Can't you eat a Steers burger? You know, it's like, but you know, but like, you know, that's actually so that, you know, the commodification and the sort of, you know, America exporting chronic illness through Coke and McDonald's and those kind of things. We need to have different structures to resolve that. And ultimately community structures are necessary.
And that community structure, I see it, you know, so valuable to so many people within, you know, counseling groups, and it's seen very much with some psychologists and that, but it's almost been limited there. It hasn't sort of broken the broader groups of, you know, medicine at all, to cardiac groups or to endocrinology groups, or, you know, just people that would need it, that could grow and get out of a chronic disease far easier with far more accountability. Where do you see it going? You know, is it going to permeate every single facet of medicine, you know, from cardiology to musculoskeletal injuries to every single area of medicine?
I mean, I hope so, but I doubt it. No, I mean, look, I mean, I'll give you an example. Like another example I used in the book is Dean Ornish, right? With his thing. So Ornish started doing this in like the 70s. And it took him 15 years to prove that you could reverse heart disease with community food and healthy behaviors, right? It took him 15 years to prove it scientifically. And it took him another 15 years to get insurance to pay for it. So surely now, 30 years later, it must be the standard of care for cardiology.
Yeah.
Nope.
Wow.
And in fact, I was at TEDMed a couple months ago, and I had a conversation with someone from ACOG, which is the cardiologist guild, basically. Not interested.
Sure.
Like, not interested. Sounds weird. Don't want to do it. And I'm like, come on. Like, and Ornish is kind of like a character because he's been so like on it. He's, you know, some people love him, but most cardiologists think he's wacky.
Yeah.
Even though he proved that it works and it can be paid for by insurance and he can actually get paid. You know, you can get paid quite a lot to do it. I think they pay $9,000 or $6,000 for a 9-week training, a 9-week program where only 2 hours is done by the doctor. So it's good for everyone. Like he really did it. But did cardiologists line up? Did cardiology practices around the country just suddenly be like, whoa, this guy's a genius. Like we should just be empowering people to reverse their heart disease. No way. They're still doing stents.
Is that because of big pharmaceutical and big sort of medical interventions and there are far more...
You can make way more money doing a stent than you can getting people healthy. And
what we're saying is that the motive's incorrect there. It's financial rather than...
The incentives are bad. You know, expecting doctors to suddenly develop massive streak of humility is not likely. You know, medical care takes 20 years, 17 years to evolve. You know, the practice and science, you know, to catch up.
Yeah.
And so, yeah, it's a sad situation. And ultimately that's why, you know, in my efforts to, you know, I like talking about these things, but I'd much rather like build the structures that can actually change things.
Okay.
We're going to shift things around.
Yeah.
And like, you know, if you just, as an example, you know, let's just say you have heart disease because of bad behaviors, right? You go, this is your journey to try and, you know, to get to a point where you can actually match a proper solution with a proper, with, you know, the solution and the problem to be the same. You go to your regular doctor, primary care. Oh, you need to see a cardiologist. You go to the cardiologist. The cardiologist wants to do a stent. You ask for a second opinion. You go to another cardiologist. He wants to do it. Then you're like, I don't want that. I'm going to go back here. Have you got any other options? And then you maybe go around in the health system. Maybe you have a stent. And then maybe you're back 2 years later because the underlying function didn't change. You're still eating the same. You still have crazy stress. You're still not sleeping properly. And so the problem doesn't go away. It gets worse. And then after 3 times around that, you've had 3 stents. You're just like, is this really the plan? Like, am I just going to keep getting more stents until one day I have a huge coronary event and die? So then you're like, oh, I want to go something different. So maybe you go to a functional medicine doctor. The functional medicine doctor goes, okay, let's get to the root cause. And, you start to, they do all these fancy tests to show that, okay, there's all these things that you could be doing. And then maybe the functional medicine doctor, if they really have their act together, says, hey, we run these groups, or we run, here's a health coach that can help you. Just think of all the steps that had to happen there to get to the actual solution that needed to happen. So I'm just like, look, let's disintermediate all of that junk and let's go straight to the source, which is that you need to change behavior. The coach or the group can do it. Let's start there, right? All these other people, like if you have a acute cardiac thing, those guys are good. You can go and see them. But we're trying to avoid that happening. And those guys don't know that it's possible. So like, why are we even asking them? So ultimately, that's more of the energy that I'm bringing at this point, which is like, let's disintermediate and actually let's use this opportunity with COVID where inertia for new solutions has been broken to actually like match real solutions to real problems. I'm kind of bored with waiting for things to change and I want to get into it. And that's why it's like the Rogue Health Economist is because like, I see that this is what needs to happen. And I'm going to make it happen. And more people are starting to realize that, that's what it takes to change. You have to like make the change and facilitate the change. The good news is there are other forces that are also happening at the same time. So the underlying incentives that would make it much more financially lucrative to keep doing stents rather than reverse someone's heart disease is changing slowly, but it's changing. So now they will start to give money. There's a thing called value-based care that's coming in where cardiologists will pay, they'll give a certain amount per patient and say, look, that's all you're getting. If you want to make up stents to do that, that's fine. But ultimately, when they get a fixed amount of money for the patients, then the economics shift and you're like, oh, what can I do that costs the least to get the most outcomes? Is putting people in a group of their peers. Right. So that will incentivize groups and health coaches. And then also you see Silicon Valley also doesn't really care about medicine either, about following the protocols. And so a lot of the innovation that's happening in type 2 diabetes, for instance, there's a company called Virta Health. It's health coaches and telemedicine helping people reverse their type 2 diabetes by doing low carb diets with telemedicine and health coaches. They're not waiting for medicine to catch up. They're not hoping that endocrinologists get it. They're going straight to the source and reversing, and they can prove that it works. They got data to show that they can reverse type 2 diabetes in 56% of people or whatever with this strategy that doesn't include any of the old guard that doesn't know what's going on. So I think that,
the patients are going to be able to maybe just because of IT and because of, all the social media available, Virtual Health can sort of advertise directly to someone who's got type 2 diabetes and tap in directly to them so that they can make a choice to rather go to a health coach than, the traditional cardiologist or medical doctor. So I think probably advertising and social media might make it more of sort of easily accessible to the person out on the ground.
Yeah, I mean, I think to a certain degree, but most of these kind of companies are going to go to whoever's paying the bill, right? There are some people that can afford to pay for that kind of care, but ultimately what Virta's goal is to go after the insurance companies and show, hey, look, our thing, which is telemedicine plus health coaches, is way better than sending people to the hospital. Send them our way, and you can save a lot of money. So, my mom's favorite phrase, which I live by, is the truth will out. Right? Things will work themselves out as truth comes out. And you can reverse type 2 diabetes with lifestyle. And if you get the right issues if you get the right services in the right order, it'll prove out over time. And the dinosaurs will become the dinosaurs. And, it's fine. It's just like, it's painful in this middle time when we know that it works, right? Yeah. We know that you can reverse chronic illness with lifestyle. And yet most people are still going down this other path because of entrenched interests. Like, it's painful to be in right now.
Yeah.
But ultimately the truth will out and it'll take care of itself. And how much pain has to be borne on each of us is our choices of the dinosaurs. They can choose to evolve, or they can choose to do things the same. But ultimately what social media is great at is getting the word out. Because the truth is, 15 years ago, you didn't have a chance to hear from people who had reversed their chronic illness, just your neighbor. Or just someone down the road. Now, someone who has a great story, who reversed their type 2 diabetes with lifestyle, can grow a huge following and start a movement. And that's what we've seen in the last 15 years. And that's why this medicine's taking off, because the truth will out.
Yeah. And also I read in your book with the millennials, peaking their health, at the age of 27, maybe they're going to start asking a few questions saying, hang on, something's seriously wrong here. If our health peak is going to be 27, we're going to start with chronic diseases in, late 20s, early 30s, that, the traditional Western medical model might not be the best for all these chronic diseases.
I mean, look, millennials have killed many other industries by just opting out of them completely. So I wouldn't be surprised at all. I mean, I think we're all counting on it.
Yeah. In terms of South Africa, do you have a network that you know of with regards to health coaches and instituting group visits, and that people could sort of inquire and get involved with and sort of try and put the structure in place? How would you suggest people, I've got some, medical doctors who listen, or medical practitioners that listen to the podcast, or we've seen the Facebook Live. Now, how do they go forward with putting these structures in place?
Yeah, well, look, Functional Medicine South Africa exists. They bring out speakers every year and they do conferences for doctors. I actually spoke to a couple of their groups, both in Cape Town and Johannesburg 4 years ago. Okay. But yeah, the speed at which this happens is really dependent on people like yourself, getting the word out and engaging. So I would say, I'll send this interview to Functional Medicine South Africa and let them know. But yeah, we could be talking about groups and group visits, but ultimately there's lots of different ways that it can happen. I think there's a real incredible opportunity, as South Africa realigns itself to like Black people making decisions rather than white people. If Black people and the powers that be in power now were able to realize that things that are part of their culture, i.e. community, could be a solution to problems that were, created, like systemically put on them by apartheid and years of corruption and whatever, that, that might be something that they take to. And if that book, were to find its way into the hands of the Prime Minister or other people in power, the health minister, and they read it and they were like, oh, this actually is super in alignment with, our values, and that it looks like this is unbelievably resource efficient for something that we are rapidly running out of resources for, maybe South Africa could be a leader in the execution of this.
Yeah, fascinating, because they've got traditional cultures of Ubuntu coming together as a community, honoring one another, respecting one another, understanding the value that everybody brings to the community and the team. Yet, there's a lot of striving towards the capitalistic model, bigger, better, bigger house, bigger cars, that materialistic world. We're almost on that wave. We haven't hit the wave of purpose and sort of meaning that comes from helping others and supporting other communities. There's a different wave since, apartheid has stopped now in terms of materialism and growing your castle and your kingdom bigger than your neighbors, where before it was the village that supported one another. So I think we're on the wrong side of the curve here in South Africa. Having said that, I think if there's a big enough group that gets together and can bring some momentum to this, because people are going to lack the finances to afford, functional medicine doctors or endocrinologists, or, then possibly there could be a way forward for group visits in South Africa. But I think being only born free now, 26 years since 1994, medicine in South Africa is on it's a tricky place at this stage. We would like to see more health coaches, more health advocates, and sort of putting these things in place, which I think will benefit the health system significantly. Yeah. So, yeah, go for it.
Yeah, look, I mean, every country has its own sort of speed at which it can develop. Ultimately, the functional medicine thing has been happening in America for 40 years. And so, there's at the beginning, it's just a few people, and then it starts to grow and it has its own momentum. But I think some of the things that are happening in America can help to speed up the movements in other countries. And yeah, I think, it's the opportunity is there. It'll become clear sooner or later that this has to happen. And so we can just, move forward as much as we can and let the rest fall where it may.
Good. Other than community, I'm just going to ask you, you've been in the functional forums for a long, long time. If you had to just list your top 3 biohacks that you do every single day, that's part of your habit and routine, what would you leave with my audience are the top 3 biohacks to implement from tomorrow?
I read to my daughter every day.
Yeah.
It gives me a great calm. Since the COVID, since COVID hit and my CrossFit shut down, we started doing family fitness.
Okay.
So we do a Tabata thing, which is 20 seconds on, 10 seconds off, and we do like a circuit. And my daughter enjoys it some of the time, not all the time. My wife and I do it. But actually, that was the most consistent exercise I've had since I was in school, because we did it every day and there wasn't anywhere else to go and I wasn't traveling and I didn't have all the excuses that I've kind of created for myself for a long time. So those are my top 2. And then, I really feel like everyone should have some sort of like group. And like I said, my men's group is this group called the Mankind Project. I know that exists in South Africa, but it's groups of men getting together to process their stuff and meeting weekly to hold each other accountable. And, I think my biggest biohack would be find a way to build that kind of community.
All right, there's a lot of value, community, family exercise there, reading to loved ones. Tell me just your last parting words. If you had a message other than your community, how important it is to you, if you had a message to the people of South Africa in terms of just overall healthcare, I read on your website, it's functional medicine intersecting with community care. What message would you give to them? Knowing, you've got a history, your dad lives in Cape Town. What would you say to the people of South Africa with regards to health and well-being?
My message is, that COVID has shown us the range of interaction that we all have with the same microbe, and that death and illness and the severity of the illness is really a function of your function. And ultimately, the majority of the ability for us to live an optimal function resides within us. And so ultimately, like why I wanted to be on the show and why I think the biohacking movement is so essential is because it's actually showcasing what the future of health looks like. And you can't, there will be, no one's coming to save you, and you have to save yourself. And the best way to save yourself is in a group. Wow. And you're going to develop the muscle that's required to take care of yourself. If, some people like yourself probably can just do it by themselves because they get the good information. But for those people who haven't built that muscle, you have to find a community of people to support you to build that muscle.
Wow, James, well said. Saving yourself, and you save yourself through a group. So basically, you're totally interconnected with others. Thanks so much for your time. Just for the podcast listeners, where can they find you? Where can they connect with you? Just your social media handles.
Instagram, Mr. James Maskell. I'm on Facebook as James Maskell, the Rogue Health Economist. And those are probably the best 2 places. And if you want to get a copy of the book, go to thecommunitycure.com.
Brilliant. And when are you going to be in South Africa for us to connect?
I'm hoping for Christmas, but I don't know. Yeah, like hopefully the lockdown ends and there's international flights again, and I'll be coming to see my dad at Christmas, but who knows?
Okay, well, Late to Thrive Show really thanks you for your time, just your mission, your mandate, the book, Evolution of Medicine, who you've connected with. I'm sure you've paid a huge sacrifice and price to get this word out, and it's against the grain. It's against big pharma, big this big food. It's really speaking about something that, is perceived not to increase financial value to people that institute it. But I'm sure the word is going to get out there. I'm going to definitely, try and connect with as many people that will institute group visits, different communities to help one another, to bring personal accountability to one another. And I think it might be a bit of a road, 5, 10, 15 years before this really gets out, but you've got to start somewhere. And you've obviously done a great job in the US, connected with some amazing functional medicine doctors. They've done their own studies. They've seen that it's worked. Insurance is paying, from Dean Ornish to, Dr. Mark Hyman, to many others, Dr. Kelly Brogan. I mean, you've really penetrated the market there. So well done to you. And hopefully we can do that in South Africa and Africa. I think it's in the genes of Africans, this Ubuntu, this community of people getting together and supporting one another. It's just to break the paradigms of the traditional, as Dr. Kelly Brogan said, this traditional patient-doctor dyad that has been so, institutionalized in this Western medical model where it's you and the doctor. I think that's probably the biggest thing that people need to somehow break, is that you can share your medical history and what's happening in your medical treatment with others. And it doesn't have to be so private as we've already spoken about. So thanks so much. James Maskell, the Rogue Health Economist, Community Cure writer, and hopefully we can connect soon again. Thanks a lot.
All right. Cheers.